For over 20 years, I've been using alternative and natural treatments for patients with osteopenia and osteoporosis. And I've always eschewed the drug therapies because the natural methods have always worked. I use a nutrient-dense diet. I have my patients add stress to their bones through using the body as it was designed. I evaluate digestion. I evaluate hormone levels. And sometimes, as a last resort, you can add drugs if the other methods have failed. But I almost have never had to do that in all those years of practice. Now, let's take another look at things. What does the average doctor do? Remember, a large portion of continuing education for physicians is financed by the drug companies. Now, first off, I found that most doctors ignore or pay lip service to the common sense lifestyle measures that can improve bone density dramatically. Secondly, before using natural treatments, most physicians will start with the drugs. And this is actually to the tune of $4.6 billion a year in the United States. And this just for the one class of drugs. Now, are they good for you? They are, according to Sally Fields on the TV commercials. This is the blockbuster bisphosphonates. And as the studies show, it's a short-term way to build bone density and reduce the risk of fractures. And at the same time, you can stimulate the economy and give older actresses work. Now, it's the usual mainstream medicine approach of filling the desire for a quick fix while completely ignoring the cause. Now, initially, I was resistant to using these drugs because in some people, they were hard on the esophagus. In fact, there were reports that these hardness on the esophagus was so severe, some people died. Studies also showed that they harm the fetus in pregnant women. And more times than I can remember, I would have patients describe how they felt poisoned immediately after starting the drug. In my mind, that's always an indicator of potential problems. Then I would talk to dental and spine surgeons, and they would not operate on a patient that was taking the drugs. They would tell me, hey, the screws won't hold in the bones of people on those drugs. And then, of course, we got the reports of osteonecrosis of the jaw. That's the death of the jawbone. It's a rare but devastating side effect. And then I studied the mechanism of action. The drug actually poisons a cell in the bone called the osteoclast, and it actually eventually kills it. Now, this is probably not good, as we are fooling with a delicately balanced system that is undoubtedly engineered for the osteoclast to have an important purpose, if not critical purpose, for healthy bones. So I had the habit of taking my patients off the bisphosphonates, that's Actonel, Boniva, Fosamax, that had been prescribed by other doctors. Now, I got in trouble and was yelled at numerous times, but I hope you can see why I had a tough time with these drugs when my natural approach almost always worked. Why would I want to put my patients at risk using the drugs? And I was sticking my neck out. In medicine, you're not judged by your patient's outcome, but rather you're judged by whether or not you follow the standard of care. I know that's completely crazy, but it's true. This means your doctor feels good and confident that she has your best interests at heart by prescribing a bisphosphonate drug. And your doctor has the federal government stamp of approval. The drug's FDA approved. And they're falling in line with the standard of care in the community. Now, with the price of over $20 a pill for a chemical that actually costs pennies to manufacture, the markup is probably over 2,000%. Hey, my health food marks up raw milk 40%, a little bit less. Now, I guess they have to cover the costs of their doctor lunches and samples for doctors. Now, the drug companies just want to be careful not to study the drugs for too long, even if they have a ton of money to throw at it. That's because they might find the real truth, which seems to me to be common sense. The truth is that there's a real risk to using these drugs. 2 new studies recently presented at the recent meeting of the American Academy of Orthopedic Surgery suggest the bisphosphonates compromise the structural integrity of bone, making it more susceptible to fracture instead of less. Now, maybe common sense and trusting our natural design is a better path to follow. Now, of course, these two studies weren't funded by the drug companies, but it seems to me, at the very least, we would want to stop prescribing these drugs until this is all sorted out. But the researchers are smart. They like to publish these types of studies. They're so important for public health, but at the same time, they know who ultimately pays the bills. Now, I quote one of the researchers here. Here's what he said. "This doesn't mean physicians should stop prescribing these drugs. To me, this is irrefutable proof that we are in a world controlled by profiteering, and medicine is falling deeper and deeper into harlotry." Now, there is a better way, but it takes courage, and it takes setting yourself apart from the sheeple that are going off the cliff. The steps for healthy bones are: 1. Eat a natural food diet that is nutrient dense, including seafood, mineral-rich vegetables, raw dairy, bone and bone broths, animal source fat-soluble vitamins A, D, and K2 containing foods, fermented foods, sprouted and soaked grains, and nuts, and other living foods. Number 2, stress your bones with physical impact forces. Number 3, control inflammation, whether it comes from a poor diet, obesity, toxins, infections, or stress. Number 4, if you have a low bone density or if you've had a fracture, measure your vitamin levels, your hormone levels, measure your inflammation level, your insulin levels, measure toxin. Take an analysis of your digestive function. Get off drugs that cause bone loss if you can. Steroids, acid blockers, antidepressants, seizure medicines, Depo-Provera, lithium, and the aromatase inhibitors all do this. Number 5, if you must treat, try superfoods, vitamins, minerals, and hormones first. Side effects from these agents are usually good instead of toxic. Natural hormones like estradiol, testosterone, DHEA, and progesterone have been successfully used for many years to treat low bone density, but because of our medical system's focus only on profit, this treatment has never been compared to drug therapy. Strontium is a natural mineral, and parathyroid hormone is a natural hormone that are also used for treatments. Now, if your doctor prescribes a bisphosphonate, look up the studies I mentioned above. Show them to him or her. Now, there probably is the occasional case where these drugs are still indicated, but at least you'll have looked at your options. This is Dr. G. If you like this video, share it with a friend. Thanks for watching.